Hello, my good people. Welcome back to my health talk show today as we keep on educating each other as we always do. So, today I want to talk about a very interesting topic here that really affects or most people don't know about. Today, I want to talk about what we call self medication or self description, or sometimes you can say self diagnosis. I know that technology has made things very easy these days. People can be able to check online, Google, and then maybe get to know what they're suffering from. But now there is a big problem in this population where people Google their symptoms and then possibly they get to know what the medications they may want to take, and then they just go to a dispensing chemist. They ask for some medications for their problem. So we want to look at what are the disadvantages, or what really is the problem with the self-medication or self-prescription or self-diagnosis. So I don't want to dispute those people who always go online and check their problems. That is very okay. But again, what I want to say is that technology has come and it has eased things, but it has never and it will never displace doctors or healthcare workers. It will never be what we call, an exchange that now people will not be able to go to the hospital to get proper diagnosis. For one, Google does not know what you're suffering from. When you Google symptoms, it will give you a range of conditions that you may be having. I've had cases where somebody comes and tells me, "Doctor, I have these conditions, I need medication." When I do ask, "How did you get diagnosed? Were you seen by a doctor?" And then someone tells you, "No, I read it online." That's wrong. The net will give you a range of things, a range of conditions, a range of diseases that possibly you could be having, but it doesn't know exactly what you're having. Sometimes people end up freaking out because somebody Googles some symptoms and then the net tells you might be having a certain type of cancer. Yeah, for example, there's someone who came and is like, "Doctor, I think I have cervical cancer." When I asked her, "Well, how do you get to know that?" "Doctor, I Googled and saw some of the symptoms I have specifically for cervical cancer." And I almost laughed at her because I felt that she had, a wrong information. So basically, you need to see a doctor whenever you have a problem and get proper diagnosis. So today I want to say some of the few disadvantages or a few problems that you may have when you do what you call self-medication or self-diagnosis or self-prescription. One thing is incorrect diagnosis. So most of the time, as I've said, that different conditions may have similar symptoms, and you end up getting an incorrect diagnosis from the net. As I've told you, the Google net does not know exactly what you're suffering from, so it will give you a very wide range of conditions that you are having. So you may end up having some symptoms which may be similar to a certain condition, and then you end up taking medication for a wrong diagnosis. So that's one. Another thing is delaying in seeking proper health care or proper medical attention, because either you Googled, you went and took some painkillers, took some medications maybe for fevers, when you have actually not treated the cause for that fever. So that is one of the things that make this self-medication a wrong thing to do. Sometimes there is what we call adverse drug interactions, where maybe somebody was taking some other medications and then you go and get some other medications from the chemist, and then you take those medications, they do what interactions, you end up getting very adverse drug interaction reactions. So it's because you are not able to see a doctor and maybe tell him or her of other medications that you are on. Another thing is what we call drug side effects. So those are two different things: drug interactions and drug side effects. Some of the drugs may have some side effects that we always advise patients to note that if you have this kind of reaction, you need to stop taking those medications. So sometimes when you just go and pick a drug and maybe you don't know whether you ever had such kind of reaction, you end up getting one. So another thing is incorrect dosage. Sometimes different medications are given in different dosages depending on what type of condition you're dealing with. So when you just go and pick a drug from a pharmacy, you may end up not knowing the condition you are suffering from. Does it need a higher dosage, a lower dosage, or how is the dosage supposed to be changed or altered? So sometimes it's good that you get to know exactly what the drug you want to take, what type of dosage it requires. Sometimes it's another thing we call incorrect manner at which the drug is administered. So here we say it's about the route. Sometimes, I have heard of one case where someone was given pessaries. Pessaries are the drugs which are mostly administered to women for insertion, that is intravaginal insertion. But someone ended up taking these drugs orally. He didn't have a proper information, maybe it could have been the mistake by the person who dispensed it, that he or she never gave the right direction of use. So she ended up swallowing the medications which she was supposed to actually to insert. So it's always good to have the right information from the doctor or the person dispensing to you. Another thing is sometimes incorrect choice of the therapy or other incorrect choice of medications. We do have medications which have been phased out, maybe from the market due to one reason or the other. So sometimes you Google and for example a drug that has been phased out, but you may find that that drug is still in the market. You end up getting the drug that cannot even be able to help you. So those are some of the disadvantages of doing what you call self-medication or self-diagnosis or self-prescription. So guys, I want to urge you that how much you may want to have, your diagnosis at the comfort of your phone or your laptop or your computer, just make use of the doctors. Doctors went to school for a very long period of time, several years studying. That's something that you want to do it just in one or a few minutes. So basically, self-diagnosis, self-medications, or self-medicating, or self-prescription is something that needs to be taken care of, especially when it comes to medications that sometimes may have some side effects on you, and you end up causing a lot of problem to you than treating yourself. So guys, take care, see your doctor, and get a proper diagnosis for you to get your medications. So thank you for today, for listening to me. I'll keep on educating you for more of those kind of conditions, and giving you what you need to know about different medical conditions, different drugs, and as they are can be used. So today I want to say thank you for listening, and keep on subscribing to my YouTube channel, and keep on supporting me in terms of following my page, Health is Wealth, and also subscribing to my YouTube channel, Osiemodaktari. Thank you, and see you next time. Bye.